by Mr. Abdul Rahim, who is the designer and the planner of the program. I'm very happy to be invited by him, and I will be here for moderating the full program. Before I give my own opinion regarding to this topic, let's introduce with our guests first. We have some distinguished guests today. So let's introduce with our guests first. We have Said Mahtab Ahmed, MD and PhD. He is a staff psychiatrist, Veterans Affairs Medical Center, Washington, D.C., USA. Very warm welcome, sir, to our program. We also have Bilkis Nahar Sriti, professional psychologist, Winnipeg, Manitoba, Canada. Welcome, ma'am. Our third speaker, Dr. Mohammad Kamaluddin, Professor, Department of Psychology, Dhaka University. Welcome, sir, to our program. We have a fourth speaker, Noor Mohammed. He is a chairman and professor of the Department of Psychology at Jagannath University. And our fifth and last speaker is Mohammad Shahinur Rahman. He's a PhD scholar, Central China Normal University, China. Is he here? Shahinur Rahman. Yes, thank you. Very warm welcome, everyone. And we already know, just before I open the floor for the discussion for our distinguished guests, I would like to give a brief background just at what we are going to discuss today. Like from the title, everybody can understand, but if someone is coming into our program, we are going to discuss about the mental health, which is the core and broad issue today. Like mental health, and we are hoping to cover both the global perspective as well as Bangladesh perspective. And we all know that a mental health issue is being less recognized in developing countries, but it is more recognized in developed countries like USA, Canada. Just before coming to this program, I was reading a report and I found that in Japan, that in last 1 month, there are more people are dying because of suicides, not because of coronavirus. And there must be some issues of anxiety, depression, or stress, and that leads to people to commit suicide. So there are a lot of mental health issues, and this is as important as physical health. So today we are going to discuss this important issue, and we will try to dig in the possible challenges, and we'll focus on both the global perspective as well as Bangladesh perspective, and we'll try to look at the way forward. Now, first of all, just to remind you that we are going to have maximum 10 minutes for each discussion, so that we can have more time for discussion at the end. And so that's it. So first, let me call Said Mahtab Ahmed, PhD staff psychiatrist, Washington, D.C., USA. Sir, would you please share your thoughts regarding mental health? So can you hear me?
I do. Thank you very much. So our question is mental health, global versus Bangladesh in brief. So let's start with some statistics on the global issues. And most of this data are gathered from American National Institute of Mental Health, as well as American National Association of Mental Illness. First of all, let's see what percentage of the workforce worldwide is engaged in mental health. It is merely just 1% of the total workforce who are engaged in taking care of the mental illness patient. Among those 1%, the highest group providing service is the nurses, which is 43%. Psychiatrists constitute 8%, while psychologists constitute 7%, and the rest is the other groups. Now, what is the psychiatrist per capita worldwide? Unfortunately, 45% of the world population, for them, 45%, only one psychiatrist per 100,000 people, while that number in USA is 16 times, 16 for 1,000. Let's see what is about the prevention awareness. That's a good sign that over 50%, which is exactly 55% of the world population nowadays, are aware of the psychiatric illness as well as their prevention. That is again 55%, which is, I would say, a good sign, which has been increasing over past several years. Now, what is the situation of world assets, money that goes to the healthcare of the psychiatric ill population? That one worldwide for the low income and low income people is just $2 per person per year. While that number, in case of the rich countries like USA, is 25 times, which is $50 per person per year. Now, whatever that amount of money is, how are they being utilized for the care of psychiatric illness patient? Overwhelming majority of that, which is 90%, are used for outpatient treatment. The remaining 10% are for the hospital and hospital beds. If we break that down, hospital bed situation in low income versus rich countries, in low income and middle low income countries, there are only 5 beds for 100,000 people. Well, that number is 10 times, which is 50 beds for 100,000 people in the rich countries. Obviously, I cannot go on and on because of time limitation. So let me see about what the situation in USA, where I have been a resident and working for 25 years. Some of the statistics in USA are like this. The so-called prevalence in a period of 1 year or 12 years period. What is the number of common psychiatric illness versus total, which include common as well as rare psychiatric illness? In case of the common psychiatric illness, that 12 years prevalence, first come is anxiety, which is 19%, roughly, we can say 1/5 of the total psychiatric illness. Second to that is depression, which is 7%. And serious psychiatric illness like schizophrenia constitutes 1%. Now, again, this data is for common psychiatric illness like anxiety, depression, as well as schizophrenia, which is 1%, pretty high. That is for common psychiatric illness. If we see the 12-month period of total psychiatric illness in America, 20% of adults, I'm talking about the adults now, 20% of the total adult population at one point in a 12-year period has psychiatric illness. And if we categorize into different races like Asian, white, black, as well as something like adults with mixed or multiracial origin, অথবা adults like lesbian, gay, and so on. That breakdown numbers are, the lowest number fortunately is among the Asians, and Bangladesh, being an Asian country, fall into that category. The highest group, on the other hand, is 37%, which is the gay, lesbian, and bisexual population. What is about whether that is total of the 20% population or Asian being 15% suffer of mental illness? What fraction of the population really gets the treatment? Asian, we, the Bangladeshi, or 15% of us suffer from mental illness in a given period. Out of that 15%, only just one quarter of them get treatment. The highest group among those breakdown numbers is for the adults of mixed slash multiracial origin. That is about 50%, which is precisely 49%. The point here is that the good sign is that among the Asian or Bangladeshi, the number is lowest, 15%. Unfortunately, however, the treatment group that that 50% people get is only quarter, which is again, unfortunately, lowest number among the people who get the treatment. Now, as I probably already mentioned that in America, for 100,000 people, there are 16 psychiatrists, as opposed to worldwide 1% for the 49% of the population. Now, having said that, what is the so-called ripple effect of mental illness? There are many. Those are in individual level, the sufferers level, the family level, community level, as well as the worldwide. On the individual level, the patient who is a mental patient, they do have statistically higher rate of certain good number of common chronic serious physical illness. And those include things like cancer, diabetes, cardiovascular, to mention a few. In the family level, what happens? The family caregiver, on average, who takes care of a family member with psychiatric illness, about 32 hours per week is spent for the psychiatric patient by their family. It's a huge toll. What happens in the community level? Among the homeless people, well, unfortunately, USA being the biggest economy on the world, there are still a good number, considerable number of homeless people. Among the homeless people, 20% of those folk has mental illness. And among the teenagers, the juvenile folks, 37% of those folk have some sort of mental illness. Unfortunately, I'm sorry, among the juvenile folks, it is 70%. And among the adults group who are in jail, 37% of them have mental illness.
Sir,
Finally, among
sir,
the,
you have 2 minutes left.
I'm going to finish. Thank
Yes.
you for reminding. Among the emergency visit in USA, 12% of those visits are psychiatric visits. What happens in worldwide? Depression, one of the leading psychiatric illness, is number one causes of disability worldwide. And depression is the leading number one cause of disability worldwide. And finally, anxiety and the treatment cost and toll for that cost 1 trillion US dollar a year, which is a huge number of money. Thank you very much. Let me stop here.
Thank you, sir, for your thought-provoking speech. We'll come back to you with some questions later on. Now, may I please request Bilkis Nahar Sriti, professional psychologist from Canada. Would you please share your thoughts regarding mental health? Thank you.
Thank you so much. I'm actually a psychotherapist. I was
Oh,
listening
so
to, Yes, that's okay because I have a psychology degree as well in
Okay.
clinical psychology. Okay, then I completed my psychotherapy degree. Now I am working as a psychotherapist.
Oh, okay.
So I was listening the data about the psychiatrist, psychologist, but I didn't hear any data about the psychotherapist. It's not new field; it's a old field, but we are still competing in this entire mental health world as a professional because we don't prescribe medication. If you know that medication controlling the all over medicine in world. So psychotherapy is not recognized as a very strong trend yet. Whatever. So the mental health, if we, I know we all are here expert from the mental health field, but I just like to give a little brief about the what's the mental health mean um, for general. The mental health is the health. Normally, what's happened when it's the physical health, the symptoms we can see that headache, pain, different kind of symptoms we can see and identify that I am suffering from this sickness. If come to the physical health, but when it's come to the mental health, we really don't see the symptoms at the beginning. So how could I define that we are suffering from mental issue or mental health? It's very clear that if it's a mental health, come to the mental health, its health is people can understand their potential, people can um, participate in their life well, they can deal with their stressor, they can cope with their daily life stressor, they can maintain their relationship. As a human being, they can contribute well to the community. When people are doing that all the thing regularly, that means that this person is mentally sound. But what's happened, what's the symptom we see regularly, that person can say that I am not mentally sound, or we can say that something going on, what's the problem? So symptoms are very, we don't normally in modern world, developed countries are taking consideration mental health very importantly. They're working, their allocation is huge for mental health. Compared to that, in our country or low income countries, they are not even aware of mental health sometimes. That's very tiny portion of people think about, know about, or seek help when they have that mental problem or issues. If I'm sad, if I tell somebody that I'm sad, in our perspective, in Bangladesh perspective, is that a problem? People can be sad, right? But it could be an issue when this sadness lasts longer, more than 2 weeks. So this is the problem, the perception of mental health. Modern world is researching a lot, they're working a lot, they have a huge allocation for mental health. In that perspective, if I give a like a little comparison, I live in Manitoba, Canada. The central city of Manitoba is Winnipeg. Winnipeg has a 1.7 million people, the population is, and their mental health budget is $372 million, Canadian dollars. Compared to that, Bangladesh has 160 million people, and their budget is 200,000 Canadian dollar per year. Is the part of the budget 0.05% of the health, and the health budget is struggling to make it above 12 proportion of the total budget in Bangladesh. So this is the mental health scenario actually, if we compare that modern world, developed countries and underdeveloped countries. What's happening worldwide? I just going through a few data that how many people suffer from the mental health issue all over the world. It's like saying 792 million that mental health directly suffer from mental health problem. And then another area is 970 people, million people suffer from drug substance abuse. And when we are saying about the substance abuse, do we identify the substance abuse as a mental health issue? No, we separate that number. But if we dig deeper, what's happening? The trauma, the childhood experience, adverse childhood experience, attachment injury, those are the core reason for getting into the substance use or dependent on the substance use. So this number is huge, and there is 14 billion in dollar antidepressants sold per year all over the world, and the huge amount of money. But if we can secure the attachment, we can secure the childhood experiences, we can secure people from the mental issues. And this is the most part that we are working on. We are thinking about that. And if we come to this point, the childhood experiences, modern countries, developed countries working on lots of budget. They are providing good school. They are trying to provide a good family. They are providing for parenting. They are providing in the school. There is from the elementary level to high school and the university. They have so many options. They have guidance counselor. They have school counselor, and they have every board has their own counselor to identify, give the children that if they're suffering from any mental issue or they want any help. If the student in the class, I mostly work in Manitoba with a non-government organization who are working on youth crisis stabilization unit. I'm therapist there. So what happened? What kind of client actually I see there? If the child is angry, it's 6 years to 18 years, they are aggressive physically, verbally, they call the crisis line and they come for therapy. And it's a one time, it's enough. If we compare to this to in Bangladesh situation, what our children are getting in their family, in their school, what's the support system we had? So one of my friend was we were talking as a student. I was working with a foster home. You know, the foster home, the children have some mental issue or behavioral problem, they come to the foster home, they live there actually. So the children were, what's the problem? I didn't see in a month, I didn't see any problem with any of the child. There were five of them. So I just asked my supervisor, what's the problem with them, why they ended up in the foster home? My supervisor said they have anger issue. I mean, what anger issue? Last 1 month, I didn't see a simple anger outburst with any of the child. What's the issue is? Then said, no, they have sometime, it's in a 3 months, it doesn't matter in a 1 month or 3 months. Sometimes they have anger outburst. And then I talked to my friend. I was saying that if it is the issue to end up in a foster home, we will have in Bangladesh, will have no child at home. They all ended up in the foster home.
Ms. Nahar, sorry for interrupting. You have 2 minutes left.
Thank you for reminding. So this is the difference between developed countries. How do they perceive the mental health and how do we perceive the mental health? It's saying that 8 of 10 of our population is somehow, some way, sometime suffer from the mental illness. And how many of them come to our like a door for seeking help? How many of them go to the hospital? Many of them have opportunity to think about that? So I can refer here the National Mental Health in survey last year. It's November, is published, and it was saying Bangladesh has 200 psychiatrists only. And how many psychologists, I don't know yet, because 10 years I'm not in Bangladesh. Kamal can say that, well, that how many psychologists is working there. So that survey was saying, if we want to bring all the people in a mental health support system, it will take 50 years only to provide service for the current population who are suffering from mental health. And this is the survey saying, and this is our total mental health system is working. So thank you so much. There is so many expert here you will say about that. Thank you again.
Thank you so much for respecting your time. And now, very, very thought-provoking speech. And we have got a very good comparison from your, and we will come back to you later on that why it is so different. The world is so different. So we'll come back to this. Now, let me invite Dr. Mohammad Kamaluddin, Professor, Department of Psychology, Dhaka University. Sir, the floor is yours. Thank you.
So thank you so much, but could you please ask me a specific question because already two speakers nicely presented
Um,
and Bilkis Nahar Sriti is my friend. She also deliberated
I have,
very nicely.
yes, sure.
So if you have a
We already
specific,
have a question, so let's begin with this. Shoaib Said from Montreal, he asked, a significant number of Japanese committed suicide due to pride-related compromise. How can we define this type of mental issue? So,
yes, definitely we can explain this issue because I had been in Japan for 4 years to pursue my PhD. So I know Japanese culture and Japanese people, and their self-esteem is so high. If something goes wrong, they alternately take the option for committing suicide. And if you go through their literature, you will find better they do commit suicide rather than to strive to live without dignity. So that is the different issue and cultural variation. But coming to the point of mental health issue in Bangladesh, I would like to start with something very different from the previous speakers because as my friend Bilkis Nahar Sriti mentioned about the last year's survey on mental health, I was there during their publication, and about 16% of the population suffering from different psychological issues like schizophrenia, paranoia, anxiety disorder, like this. But this is not the reality of Bangladesh because mental illness does not mean the remaining people are mentally healthy. So you have to differentiate these things from other countries because in our country, the student comprises of a big portion of the total population. They are the students and they are going to school. Their school is not so student friendly. They are going to school with lot of teachers, lot of books, coaching centers, and the expectation and aspirations of parents. Everything is a burden to the students. So even though globally 16% of the population is suffering from mental illness, but they are considering that remaining 84% are mentally healthy. No, mental health does not mean the mere absence of disease or infirmity. If we consider that way, to what extent we people are healthy, whether the environment is congenial to be healthy. In the school, if you go to the school system of Bangladesh, students cannot play during their school time or after the school time. Even after the school time, they have to go to the coaching center. Parents are highly competitive and very expecting many things from their children, even the unfulfilled desire of the parents they impose that this should be done by their children. So whether we are mentally healthy or not, that should be a big question for Bangladesh. And whether you will treat mentally ill or whether you will promote mental health, that is also a big question. As my friend Sriti talked about school counselor, we can prevent many of the problems if we employ psychologists in a school, especially school psychologist, educational psychologist, school counselor. But mental health is still considered in Bangladesh from two different professional perspectives, either psychiatrist or clinical psychologist. But mental health is a profession that should be shared by many people like psychotherapist, psychiatric social worker, psychiatric nurse, and many more professionals work together. And if you can deal a larger population to promote mental health instead of preventing or treating mental illness, you can save many things. And in Bangladesh, you can have a look that percentage of investment or percentage of allocation of budget is so negligible for mental health. And in Bangladesh, to my knowledge, only there are two hospitals specialized for mental health. One is situated in Pabna, the other is in Dhaka city. And rest of the medical universities or colleges have their outpatient treatment center with a psychiatric ward. So many people cannot get access to mental health support system. So from that point of view, Bangladesh is really in a miserable condition. And especially I am focusing on students. Why? The system itself is contrary to mental health. Why? You can see the number of books our children need to read, either in class 1, class 2, class 3, class 4, disproportionately weightful, more weight than their own weight. So that should be figured out. And still, the education board, national curriculum board have set specific books, but there are certain schools, English medium schools or some other kindergarten schools, they are so ambitious. They add many more books to this without considering the age and their cognitive level. So this is again a burden for the children. And the aspiration of our parents, they all have to get GPA 5. That is another issue. And in Dhaka city, if you look at, you will find how many schools have playgrounds and what is the definition of education for these children. If education is defined from broader comprehensive perspective, then education does not mean you need to learn only something from the books. You need to go to the playground, you need to the nature, go to the nature, you interact with your neighborhood. So there is no provision of these children. And what kind of citizen we are going to prepare, whether they are becoming resilient children or not. They are easily vulnerable. They do not take the uh, stamina to fight against some odds. So this is the educational system in Bangladesh, and considering everything, the mental health cannot be figured out just figuring out only mental illness. The last year, the National Mental Health Survey says only 16%, but in my view, the remaining 84%, what percentage of that population is mentally healthy? Mental health has also many dimensions, and you can measure the mental health continuum. Somebody is moderately mentally health, somebody is borderline, somebody is really healthy. So that should be taken into account. Without focusing on mental illness, we need to focus on how to promote mental health. So that's all about from the perspective of Bangladesh, and I am sure I am not focusing on other institutions. As you, Dr. Farah, you are a university teacher, Dr. Nur Muhammad, Dr. Shahinur also. How about the university education? Whether the environment is congenial to lead a meaningful and healthy, mental healthy life? Always politics are there. Teachers are not working well. They are not teaching well. They are not doing research. Is it a good field
Culture.
for culture? Yes, it is. It is not a good culture for maintaining a mental health. So if you take into account all the issues together, we are not really mentally healthy. So thank you so much for inviting me, and it is a nice opportunity to see my friend Bilkis Nahat. She was my classmate in Dhaka University, and I really happy to see her after a long years of at least 10 or 15 years.
Mhm. Thank you, Kamal.
Thank you, sir. Um, it's wonderful to hear from an expert in this field. But to me, that like a layman in this area, when we talk about mental health, if we talk about this issue, like I'm mentally sick, but I'm mentally ill, that means that in country like Bangladesh or in any developing country, it's like you are insane or you are abnormal or you're mad, something like this. But I was in Australia for 5 years, and what I found that they are treating mental health issue as important as physical health. and everybody is very concerned about it. And it's like what I so what is my understanding is it's a kind of a cultural thing as well, that how we are looking at this issue. We have to admit that this is as important as physical health. This is the first thing what I feel, that we have to admit this first, then we have to go forward. But without admitting this, without accepting it as it is as important as physical, we cannot go forward. That is something that comes in my mind. Thank you so much, sir. We'll come back to you later on. Now let me invite Nur Mohammed, Dr. Nur Mohammed, Chairman and Professor, Department of Psychology from Jagannath University. Sir, floor is yours now.
Thank you. Good evening. I, at first, I'd like to give thanks Dr. Farhana Nawaz and others discussants and all the viewers who are hearing this discussion. And thanks everybody. I am basically IO psychologist, but now I am practicing mental health issues. I am observing that in Bangladesh, there are so many people, just 2 crore people out of 16 or 17 crore people in Bangladesh, they are affected in psychological disorder. Mahtab Ahmed already mentioned that 19% they are suffering anxiety disorder, and depression 7%, and maybe schizophrenia 1% in globally. In Bangladesh, problem is there. We are not able to identify or assess these types of disorder. They think that it is one kind of social stigma. Social stigma is a problem in Bangladesh, and many people or children, they are suffering neurodevelopmental disorder because of, we know, neurodevelopmental disorder due to neuron problems or nervous system problems, but they are not assessing what types of problem. Neurodevelopmental problem, there are 5 or 6 types of neurodevelopmental disorder. One of them is ID, intellectual disability, autism spectrum disorder, but they are not assessing or diagnose these types of disorder. This is the problem in Bangladesh. We think that already Bilkis Nahar mentioned that in Bangladesh, survey findings indicates that 5th May 2019, there are only 250 psychiatrists in Bangladesh, and only 60 psychologists, clinical psychologists in Bangladesh, they are practicing. And psychiatric nurse, there are 12,000 psychiatric nurse and 10,000 medical officer. They are trained in psychological disorder. This is the statistics. But problem is there, I have mentioned, in the different areas of the Bangladesh. In case of industry, Dr. Kamaluddin sir already, he is my direct teacher. Kamaluddin sir is my direct teacher whenever he served at Rajshahi University. He is my direct teacher. So Kamal sir already mentioned is a school psychologist, the role of a school psychologist in the field of education. And I have seen that the role of IO psychologists in case of industry and organization, they are suffering many problems. Mainly, they are suffering anxiety disorder. Anxiety disorders means anxiety, social phobia, phobic disorder, that means social phobia, and others psychological disorder. But they are not getting or assessing what types of disorder they have. They are not taking the treatment. But nowadays, I think we are observing that in Bangladesh, many psychologists, in case of school, college, and others institutions, they are appointing psychologists. They are appointing psychologists, but few numbers, very few numbers. In that case, we the psychologists are hopeless. What can we do? In that case, Dr. Kamaluddin sir and others, Dr. Shahinur Rahman, Shahinur Rahman and others faculty members, they are trying to how can we provide psychological support of that people. In that case, we are trying, but due to many reasons, they are not getting or taking the psychological support from the psychologist, psychiatrist, or counselors. In Bangladesh, Dhaka University, there are two departments. Only one department is psychology department, master's program in clinical psychology and development, educational and counseling psychology. At Jagannath University, three departments. You can say one department, but three branches, specialized branches. Like one is clinical counseling, child psychology, science, developmental and educational psychology, and IO psychology. The three branches of psychology, a specialized field. We are providing some psychologists, mini psychologists. They are giving their counseling and others activities, providing the organization and others institutions. So this is the beginning. You can say this is the beginning. Just we are trying to provide some psychological support in every areas of various field of Bangladesh. But many people they are living in remote areas, but they are not assessing neurodevelopmental disorder. This is very much significant for assessing them. Otherwise, they will face another psychological problems. Parents are facing many problems to deal them. So, with the psychologist in Bangladesh, we are trying to give them support and to remove these types of social stigma, and how can they get this type of psychological support. And during pandemic we have arranged many Facebook live programs so that people can aware about the psychological disorder. In that case, as a chairman of this department, we are trying every day. We are trying how can we increase the mental health of the people of Bangladesh, either employee or other people in Bangladesh. So it is our great opportunity, and we are inviting all the psychologists to give them psychological support. And we need psychological support for better mental health, and all the psychiatrists, psychiatric social nurse, pharmacologists, others, all the members. We are every day inviting them. So what can we do for the nation? As a public universities teacher, we are taking a large number of money from the government. So what can we do for the government, for the people? We are taking the people's money. So it is our duty, it is our responsibility. We are trying in Bangladesh, but it is very tough job for us, because they are not interested to go to the psychiatrist or psychologist, because they will say as if pagol, you are mad. So why are you going to the
Dr.
psychologist?
Noor Mohammed, we have 2 minutes left. Last two
Okay,
minutes
thank
for
you. But our Professor Dr. Muhammad Kamaluddin, he's trying very hard for providing the school psychologist to serve the students, those who are reading or facing some problems in case of in educational institution. So I am uh, very much very much I'm just thinking that these people, this psychologist will serve all the peoples in Bangladesh, but it will take time. So thank you everybody. We are trying to give the psychological support, and for arranging these types of program for awareing the peoples and about the psychological health. Thank you everybody. Thank you.
Thank you so much for your beautiful presentation. Now, the last speaker of the program, Mohammad Shahinur Rahman. He is a PhD scholar from Central China Normal University, China, and he's also an assistant professor of Chittagong University. So far, I know. Am I right? Okay, sir. So the floor is yours. You can go on.
Thank you, Dr. Farhana Nawaz, and giving me the opportunity to say something about mental health issue. Actually, I'm eagerly hearing all of the good speaker like Dr. Mahatab Ahmed, Bilkis Nahar, Professor Dr. Kamaluddin Sir, and as well as Professor Dr. Nur Muhammad. They actually they all are give actually plenty of information and data. Actually, I want to focus the thing that actually missing. I feel that was actually in Bangladesh. We are the underdeveloped country. Yes, always have some issues like in overall the world. Actually, underdevelopment country all are have some problems. That's why the mental health issue actually not addressing here properly. However, from last 10 years, I'm observing that the situation has changing. Our government realizing that the mental health is an important thing which need to be addressed. That's why in last year, I found government make a draft for mental health policy. Actually, which is the, I think which is the landmark and which is the actually beginning. Actually, mental health issue, mental health sector in Bangladesh is untouched issue, untouched issue. So that's why actually no one government and other private organization didn't invest in this sector. However, in this COVID situation and previous some important things like a few years ago, you know, the shower tragedy. I think you all know about shower tragedy. In 2014, there nearly about 11,000 people died in a big building crashed, and there the people who are survived there at that time I observed that the psychological issue actually the people all kinds of people, even government and other people realize the how necessary the mental health issue. And at that time many survived people at that time facing serious psychological problem, PTSD, and general anxiety, and some people were faced at the time panic attack. So actually, people are realizing about the mental health issue, and from that perspective, I think later on, government, another issue arises in 2017. I observed that the Rohingya issue, the huge large people fled from Burma, and they took shelter in Cox's Bazar area. Huge people. So from that issue, they actually they are survived. They actually live from their country, and they are all the people are in so much stress. And at that time, when they get shelter in Bangladesh, and various organization, various government and non-government organization take realization that these people are really in danger. And at that time, actually, this psychological matter come to get what is called it's the priority. And in recent year, you know, during COVID-19, the psychological problem rises everywhere. So government truly realize really mental health issue is a really serious matter, because so many research in around the world, uh, Lancet article, and so many researchers, they predict that during this time, mental health issue will rise 3 times higher. So actually, in reality, in Bangladesh, there is a it's actually one the last time Kamal sir and Bilkis Mahar, they gave the data that 16 point something in last year, the survey, uh, their adult mental health problem in Bangladesh about 16%. 16%. So think that if it is 16%, so it's our total population was our population now in 16 crore. So if this 16%, so it's around 3 lakh people, around 3 lakhs people in mentally in danger about their mental health issue. So this is a huge number. So I think so overall, all these perspectives, I think now government realize that it's a very important things. That's why they focus on the mental health policy, and they're developing it gradually. And I think all sectors of professional psychiatrists in Bangladesh and senior scholars, all are contributing to making the mental health policy. Actually, it will give us the better, make our Bangladesh mental health issue better, I think. So one thing I also want to mention here, that the Bangladesh government actually in previous didn't realize the importance of mental health issue. So in 1992, Bangladesh government established Shishu Bikash Kendro in 1992, and later on in 2008 they made it took under the Bangladesh Health and Family Planning Ministry, under Family Planning Ministry, and they took it to the under the government project. And at that time, in 2009, in 5 medical college, they first start the Shishu Bikash Kendra. That means this is the first milestone where psychologists, especially child psychologists, start their profession actually serving to the community, especially child. And there they serve autism child, and also they assess developmental delay children, and also speech delay, cognitive delay, and
Shaibur
cerebral
Rahman,
palsy.
you have last 2 minutes, sir.
Okay. So, inattention is to, they also deal inattentive children, and as well as a mentally retarded person and intellectually disability children. So actually this starting. So I find here hope for mental health issue in Bangladesh perspective. And this project was successful, and so much successful that later in 2010, government extend 5 medical colleges, extend this project for next few years, and add 5 new medical colleges. And they recruited a child psychologist, and this project also very successful. For this reason, later on in 2014, they extended 5 medical colleges again in different areas of Bangladesh. So in this total 15 right now, in 15 medical colleges in Bangladesh have the post of child psychologist. So and recently I saw another circular given by the health ministry. They published, they circulated 20 posts of psychologists. So it seems to me that actually this figure is increasing, and I think if we prove that the mental health issue is a very important thing, and it's need to children to adult everywhere, it actually necessary and very important things. And of course, I think our government will realize, and people also will realize that really it's a very crucial thing and very necessary things. And actually, these blame actually goes upon us, because we need to make this situation, and
Last minute.
we have to show the actually how it's really necessities. And in this way, I think the mental health issue now in a very small portion, but day by day, I think in Bangladesh it will come up in a big way. So I hope and that in near future, uh, the mental health issue addressed by the government a very bigger way, and that will change our psychological phenomena. Actually, that will help us to realize and reduce the mental stigma relating to mental health issue. So that's for all. Thank you.
Thank you, Muhammad Shahinur Rahman. I have a question from Nazmul Hassan. Actually, he wanted to know that, yeah, as you said, that government is taking a lot of policies and promoting mental health issue, as you said. But he wanted to know that do you have any success stories apart from like extending medical colleges or this, or any real life examples? Do you have any success stories from Bangladesh, but the outcome of these programs that have been taken from government? Can you tell us anyone have any success stories?
Uh, of course, there's a huge successful story. Actually, if you search the internet, there's a lots of evidence there. And so actually the project, the project government took in different medical colleges, that was wonderful. And there was a documentary they created. The root level people are asking how they feel about after taking their service from the medical colleges. So they feel better. Yes, it's really necessary, and it's actually fruitful. But unfortunately, this project is still under it's actually not in revenue. It's actually non-revenue project, and it's going on the basis of project. So, but the child psychologists and doctors who are working with this project, they are really doing good. And one of my friend is still working there, and he has lots of patients who are actually getting benefit from those what is called is Shishu Bikash Kendra. So I think that was the awesome program and awesome project from the government, but we need to extend it. It's only now in 23, 15 government medical colleges and 8 non-government medical colleges. So in total, 23 medical colleges have this service. But in people are demanding that the government should extend this service to the all medical colleges. You know, in our country, we have 105 medical colleges. So if it increases, so actually the root level people who are taking getting mental health service, actually primary healthcare service. So it actually help the mental health issue in primary medical service. So actually that would be the main. I think that would be a good job if we able to do this, or pursue government and other policymakers to do that.
Thank you. Thank you. We have at last we have heard some. We have seen some beacon of hope, because all the times we're talking about some negative things about Bangladesh, but you have said some positive things, which is good, and we are hopeful about it. Now, let me wrap up the program. Like we have, it's been a very interactive and very good conversation. And from Said Mahtab Ahmed sir, you have given excellent statistics regarding mental health. And but I have one query to you. Like as you mentioned that in USA, like according you said about some statistics that race, age, gender and sex, this really matters. Like but my question is why this is so, why the race is a factor in terms of mental health, or which age group are most affected by mental health in USA. Would you please address this issue, sir?
Sure. Thank you very much. The first thing is why the race is important, and the second question is what age group is mostly affected. Given the limitation of time, let me give you a 1 minute answer to the first question: why the race is important. Here's the thing: if we look into the definition of depression, for example, a very simple but comprehensive definition of that is depression is a sense of loss, whatever type of loss it could be, whether that loss is real or perceived. If I explain that, it is a sense of loss. It could be monetary loss, prestige loss, power loss. It can be pride loss. And that loss can be really a real thing, like losing the job, like family being broken. Or it could be just a perception that my boss is not happy with me and I'm going to lose my job, which may or may not be the case. So again, depression is a sense of loss of any kind, whether that is real or perceived. Having said that, different races, depending on their socioeconomic background, society, and so on and so forth, they perceive things differently. And therefore, race is an important issue in determination of the mental illness privilege. Going to your second question, what age group is mostly affected? It's probably not uh, precise answer what I'm going to say now, but if I say that the age group from 21 to 30, or even broader range of 15 to 30 years old, the suicide rate is highest in that group. And because we know that the suicide is the extreme form of depression, by that token, we probably can say that that age group is the mostly affected. Does that answer your question?
Yes, thank you, sir. Excellent answer. And I have one observation from Bilkis Nahar, ma'am's your speech. Like as you said, you had given a comparison in terms of budget allocation between Manitoba and Bangladesh. But we have to come to that point. Like Bangladesh, we have huge issues. We are having a small country but huge number of population, and we have a lot of challenges, but still what do you think that why the allocation is so low in Bangladesh? What is your opinion regarding it?
Thank you so much, Farhana Nawaz. I just like I'm interested to go there because there is a two thing here. One thing that how many people come to the facility seeking help for mental health, because it's because of the awareness. People doesn't know much about the mental illness, what's the symptoms are, when they need to go to the help, because people are struggling with their personal life every day, their bread and butter every day. So there is the big gap that if people are not coming to the mental health support system, then why government will allocate the big budget? Because our total health system is not highly protected by the budget or the support yet. So when people are suffering and dying from the physical health, then mental health, how important is that for the root level people? Do they know about that? Do they aware about that? So this is the balance that people will start coming to the health system, or health gonna go to the people. depend on the budget, how the budget will be allocated. If people are not coming, it's not help is going to the root level to provide with the people, so budget will be remained there. I was listening from Muhammad Shahinur Rahim. He gave us lots of positive stories, but those stories are on the table. Those stories are in a symposium seminar, but how many people knows about that, how many people is going to the root level? This is very important. Budget could allocate it more, but we have to make sure that people understand mental health issues.
Yes, I think we have understood. And now I have a question for all of you, but I would like to start with Dr. Kamal. Sir, what do you think? How COVID-19 is contributing to mental health issue? Like, what is the pre and post things you're seeing,
COVID is
COVID-19,
COVID-19 is
and
contributing
how?
to mental illness, not to mental health.
Not mental illness, yes.
Definitely, our mental illness is aggravating. But before we go to the question, I would like to add something which is very much aligned with the speech of Bilkis Nahar. In Bangladesh, you are a university teacher, you know, we have 50 public universities. Out of them, only 5 universities have psychology department. So how can we expect that mental health will go to door? And in Bangladesh, there are more than 100 private universities. So within the university, psychology should be a department where this psychology department can help the students in that university as well as the cater the need for the rest of the population in the country. So who are the educationists in Bangladesh who decide which subject to open, when to open, why it is required to be opened? So out of 50 universities, only 5 universities are offering psychology. So you can imagine what Shahinur has said, that is very good from the initiative of the government. But what the universities themselves are doing, this is one story. And there are many more issues. So I don't want to talk about those issues. It might take the form of a political. Even in India, in every IIT, there is a psychology department. I have visited many universities, many IITs. But in Bangladesh, the IIT or technological university vice chancellors, I talk to many of them, they do not think it is required. So if it is the condition of the highest level of people, what ordinary people will think? So from this statistic or from this idea, you can think of how people as a whole perceive the concept of mental health in their own country. Lot of bragging, lot of things are happening in university, and students are the victims.
Sir, we
Sometimes
have to
they cannot. Yes,
sir,
I understand your
sir,
time is very
yeah,
limited.
time is limited. Sir, can you please
So
address COVID time? COVID time, how
definitely,
it is
definitely, I
contributing?
will focus this term because during this COVID-19, the worst sufferer are two kinds of people. One is the students, especially the youngsters, and the other group is who have lost their job. So during this time, government should have some policies, university and schools should have some policies. So with that policy, they can be connected with the students, they can be connected with the teacher, and during this time, so that the students do not feel empty. There was no provision. Even I have visited and I have connected with many countries during this COVID time. I was connected through Zoom. In even in India, there are a lot of programs for the parents, for the teachers, for the students, so that they do not feel that we are isolated. They have to have some connection with the society, with the peer groups, with the teachers. But in our case, this doesn't hold true. So COVID-19 has a severe problem, contributed severe problem to mental illness of these
So,
people.
do you have any statistics in our hand that how many people, including children, are affected by COVID uh,
We
in
have
terms
only
of mental
statistics. So
illness in
yes,
Bangladesh?
yes, during the COVID-19, we have chalked out some programs through online. telecounseling and psychosocial support, and also Facebook Live. And through telecounseling, we have got a lot of people who came to have mental health support from us. From that statistic,
Mm,
we can say the number is huge, number is big.
mm.
Even though I cannot actually figure out the actual statistic, but from that point of view, I can estimate. Yes, the number is very big.
Okay, thank you, sir. My last, so I have to conclude this session, but my last hunch is what would be the way forward? Yes, we know that it's being less addressed, less recognized by people, by government to some extent. We have low amount of budget, but we should find out a way forward. And I would request Dr. Noor Mohammed to focus on this issue, that what would be the way forward, how we can proceed regarding it. I know that we all know we have a lot of challenges, but how we can overcome, how we can proceed, how we can overcome the challenges, both from the government side, from people side, from everywhere. What should be done?
Thank you for giving me chance again. I would like to say that need social support, family support, government support, budgets, etc., and all the NGOs and others organization provide support for increasing the mental health of the people. As a psychologist, I would like to say your during pandemic psychological conditions like how can we increase our mental health? One questions from viewers. I would like to give explanation about this matter. We can that means pandemic created some fear and anxiety, frustration and depression, etc. So how can we control these types of anxiety, these types of frustration, etc. But we can use some technique for maintaining our good mental health. In that case, first technique, I think that you should emphasize present on focus. Present on focus. You should think that you are not only one affected by the this pandemic. Many peoples in the world, in Bangladesh, they are affected. So you have to present on focus situation. How can other peoples are protecting these types of pandemic? So you must follow some techniques. You can you can take some relaxation training, others social training, tele-counseling for increasing your mental health in this pandemic situation. Your first question was that, so with a psychologist, with a psychiatrist, psychiatric nurse, psychiatric social worker, government, NGOs, and others concerned, they must give attention about psychological health, psychological disturbances, and for increasing their psychological well-being. Otherwise, not possible. Bangladesh, I have mentioned Bangladesh. In Bangladesh, there is a big problem, social stigma. So we have to promote them. So can they are go to the psychologist, psychiatrist, or psychosocial counselor to take
Thank
to
you. Thank
take
you, sir.
the mental support.
Can I add something to this
Yes,
Exactly.
point?
last
People of
point, last minute,
Bangladesh,
sir. Hmm.
okay, people of Bangladesh is not so stigmatized as we are speaking of. Basically, we do not provide the support needed. So this pandemic situation that we have to learn. SDG 4 includes quality education. If you can include quality education in Bangladesh, especially from primary to tertiary, then mental health problems will be minimum. And you have to open psychology department in most of the institutions so that they can cater the need for local needs, as well as why don't we consider school psychology for school, college, madrasas, and other places. Recently, there was a High Court writ petition where psychologists will be employed, but in the disguise, inside it is written clinical psychologist will be employed. This is a very bad instance for Bangladesh. If you employ clinical psychologist, that means you are considering people of Bangladesh as pathogenic. Students of Bangladesh are mentally sick. Our children are not sick. Our teachers are not sick. What they need to boost up, they need to promote their mental health. To promote mental health, you need a school psychologist. To promote mental health, you need a school counselor. To promote mental health, you need educational psychologist. So
Thank
this is also something that is going on inside Bangladesh that prevents the support to provide. So
thank
I
you.
think we need to rethink about this
Yeah,
issue.
thank you so much, sir. So we are just coming to the end of our discussion. So we have, let me conclude by telling that mental health is as important as physical health. And I was reading a report a few days ago where I found that depression is the second largest illness in the world. And every 40 seconds, someone is committing suicide. And this is just the outcome of depression or anxiety or stress and so on and so forth. So there is no way to look at this issue lightly. We have to be conscious. This is a very serious issue that needs to be addressed by the government, by the third sector, by people everywhere. It is everybody's duty to address this issue and to work accordingly. And as we said 1,000 times, that our mental model needs to be changed. And at the same time, we have to admit that it is an issue, big issue, and it is as important as physical health. And then we cannot leave everything to the government. We also have to come forward, and government will also have to come forward to and take it as a serious issue. And we need budget allocation for this, and the policies that are on the table, we want to see this in practice. So that's all for today. Thank you very much for coming, and thank you very much for inviting me as well. Let me conclude the session. Thank you so much.
Thank
Thank
you.
you.
Thank you so much.
Thank you for